If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Hi everybody, I'm Dr. Paramjeet and welcome back to my channel. We are talking about fats, and if you have not yet subscribed to my channel, then do that first and then go to the playlist where there is a playlist on fats, and that's where the previous 3 videos are there which explain more about fats, and you need to watch them first to understand the basics and background about fats. What are fats, why they are important to us, why should we eat them, and then how they are produced and what effect of heat, what happens when you heat them, what happens when you refine them. The truth about everything, the basics about everything is explained in the last 3 videos. If you haven't seen them already, then go back to my channel, search for the playlist, subscribe the playlist and watch these videos first, and go and come back to this, and then you can go further. Today we are going to talk about selecting healthy edible oil in an Indian context. What kind of oil should be used in cooking in India? So before that, obviously we have already studied about the types of oils, the saturated fatty acids, unsaturated fatty acids, saturated fatty acids being short chain, medium chain or long chain fatty acids, then unsaturated fatty acids being monounsaturated or polyunsaturated. Polyunsaturated are further divided into 2, basically omega-3 and omega-6 fatty acids. Omega-3 are also called as alpha linolenic acids, and omega-6 is also called as linolenic acid. And the actual ratio of these two also matters, omega-3 by omega-6. The presence of this ratio in the oil actually matters for the health benefit aspect. And guys, for that matter, these 2 fatty acids are the essential fatty acid. Now what do you mean by essential? Essential means all other types of fatty acids, if they are required by the body can generate them by the food we eat. But these 2 fatty acids, omega-3, omega-6, that is linolenic acid and alpha linolenic acid, cannot be produced in the body by the body, so you have to consume them. But the requirement is obviously very small, and that's why the daily dietary allowance is also very low. So let's understand, all the edible oils which we know about have several fatty acids which can be either saturated or unsaturated, which might be monounsaturated, polyunsaturated. Some may have more amounts of omega-3, some may have less amounts of omega-6, some may even have trans fatty acids by the process of hydrogenation, which we already studied. Below this video, in the description, I am sharing a link, couple of links which give the idea about the fatty acid composition of edible oils, and then you can study which oils have more saturated fats, which have less unsaturated, which have more linolenic acid, omega-3s, which are low in omega-3s, etc. This chart will help you choose the ones you want, but there are some studies which help us. But before these studies, a fact. Did you know that edible oils contain several antioxidants like tocopherols, oryzanols, carotenes, tocotrienols, phytosterols and other micronutrients? All these are good for you. But obviously they are destroyed in the process of cooking. They are destroyed. Many of them are destroyed. Many are destroyed by exposure to light. Many are destroyed by refining. So the point is, you cannot have it all. You have to choose what is best for you. For that, we rely on studies. What are these studies? These are research work which tell us that what percentage of risk was found on consuming what kind of oils. We all know that saturated fatty acids are harmful when consumed in a large amount, as they can increase the total cholesterol and the LDL cholesterol. If you don't know what these kind of cholesterols are, you need to check out my cholesterol video to understand what types of cholesterol are, and then get back here to understand more. But for now, understand that saturated fatty acids increase the cholesterol as well as the low density lipoprotein LDL cholesterol, which therefore increases the risk of atherosclerosis and heart disease, heart attacks, and CADs, cardiovascular diseases. A meta-analysis of randomized trials, that means a lot of trials are analyzed together. These meta-analysis suggest that a 17% reduction is seen in the risk of heart diseases, coronary heart disease, in studies where consumption of saturated fatty acids were reduced from 17% to 9% of energy. That means in the whole day, if 9% of your whole calorie intake is coming from saturated fatty acids, then the risk of coronary heart disease reduces by 17%. However, we know that short and medium chain saturated fatty acids are not harmful, as they do not have effect on serum lipids. But one of the randomized study indicated that even after 2 years follow-up, serum lipids were not altered by coconut oil as compared to sunflower oil. But the amount of coconut oil consumed was low, because coconut oil is very rich in saturated fatty acid. So it does not matter what type of oil you are eating, it matters the amount. If you want to eat saturated fatty acids, then you have to eat very less amount of it. Very, very less. There was another trial, a randomized trial, which indicated that after 2 years of follow-up, serum lipids were not altered by even coconut oil, which is very rich in saturated fatty acid as compared to sunflower oil. Now, that has a significance. A recent study suggests that saturated fatty acid may not be that harmful as considered earlier, which means that eating saturated fatty acids may not increase your chances of having a heart attack directly, but there is no debate that saturated fatty acids are loaded with fats, and eating them at high amounts will lead to obesity. Now, another studies which are done on PUFAs and MUFAs, polyunsaturated and monounsaturated fatty acids, they show that these fatty acids can actually lower the LDLs and are cardioprotective. These reports say that if you substitute saturated fatty acids with polyunsaturated fatty acids, they can significantly reduce the coronary heart disease risk, and in that the omega 6 and omega 3 linolenic and alpha linolenic acid, which are the essential fatty acids, are required in a proper amount, proper ratio. Out of them, the omega 6 fatty acids lower not only the LDL but also decrease HDL, which is bad. So omega 6, if you take in a high amount, is bad. And let me tell you, all the vegetable oils which we eat are high in omega 6. Whereas if we talk about omega 3 fatty acids, they lower the triglyceride, lower the blood pressure. They also help in inflammation, improving vascular functions, and even help out in preventing sudden cardiac death. So omega 3 is good. Omega 6 and omega 3 fatty acid should be present in adequate and a balanced proportion in the body, because both of them compete for the same enzyme that convert them into the more active components. Therefore, if there are more omega-6s, much more omega-6s, then omega-3 will be suppressed. Several recommendations suggest that the ratio of omega-6 and omega-3 should be either 5:1 or 10:1. So the range is omega-6 can be taken 5 to 10 times the amount of omega-3s, but omega-3 should be included in the diet in this amount to prevent heart disease. Let's talk about trans fats. Several reviews have demonstrated that a high intake of trans fatty acids is associated with increased cardiovascular risk and mortality, and possibly other chronic diseases like Alzheimer's disease, cancers, diabetes, obesity, inflammation, depression, etc. Then there are antioxidants. Antioxidants which are present in several oils, which we already saw: tocophenols, oryzanols, phytosterols. They have a favorable effect on lipids and oxidative stress and prevent heart disease. Now, let's talk about oils. Some oils, let's see examples. Studies indicate that olive oil intake can actually have various health benefits, including and in addition to decreasing the risk of cardiovascular diseases. It's the polyphenolic compound inside the olive oil which has the beneficial effects on plasma lipid concentrations, and they bring about a linear reduction in the oxidative stress markers. However, olive oils does not have the ideal omega-6 omega-3 ratio. Therefore, it may not be the best option for Indian cooking. On the other hand, let's talk about mustard oil. Mustard oil is considered healthy edible oil because it is low in saturated fatty acid, high in monounsaturated and polyunsaturated fatty acid, and it has the near ideal omega-6 omega-3 ratio. Plus, it is also available in non-refined or cold compressed form. It is also relatively stable during cooking at high temperatures. Several studies have also suggested that mustard oil may be associated with lower cardiovascular risk as compared to other oils. There were even a multi-centric epidemiological study reported 71% reduction in coronary heart disease risk among individuals using mustard oils for frying as compared to sunflower oil. There was another study which was actually double-blinded. A double-blinded study is where people who are being studied and people who are studying don't know each other and they don't know about the study as well. Anyways, that's a different concept. A double-blinded study demonstrated that acute heart attack patients who are using mustard oil, there was significant reduction in arrhythmias and heart failures and angina. So if you are eating mustard oil and you have a heart attack, there are chances that it's going to help you. That you will have less amount of arrhythmias, less chances of heart failure. Now, I understand initially, like in 1970 and even in other in foreign countries, especially in US and Canada, mustard oil is still banned. That is because based on earlier studies in animals, especially rats, there was a concern regarding the high erucic acid content of mustard oil. However, now recent studies have showed that in rat there is an inefficient activation of erucic acid to erucyl coenzyme A, along with there is a lowered activity of triglyceride lipase and enzymes associated with beta oxidation of erucic acid, which actually lead to the accumulation and retention of cardiac lipids. But this is the case in rats. Other species, including humans, do not have not demonstrated to have such toxic effects. And let me tell you, even though mustard oil, because of is banned in US and Canada because of erucic acid studies in animals in 1970, Australian scientists have studied these factors in mustard oil, and they have also set up a daily limit of 500 milligrams of mustard oil per day to be safe for consumption. And this level also still has 120 times of safety margin, to be exact. So ideally you cannot get, so technically you cannot get any harmful effects of erucic acid because of mustard oil consumption. So mustard oil is one of the very promising contender for an ideal Indian cooking oil. Another oil is low erucic acid rapeseed oil, also called as canola oil. By virtue of its ideal omega 6 omega 3 ratio, it is also very cardioprotective and it's very useful. But as we've already seen, canola oil on a crude form is very low smoke point, so it cannot be used in a crude form, has to be used in a refined form. There is another oil, then flaxseed oil. Flaxseed oil is a rich source of omega 6 and is commonly consumed. Now let's talk about Indian cooking conditions. In India, mostly while we are cooking, all the oils are subjected to very high temperature. Like in deep frying, oil can go above 170 degrees centigrades, and it has been demonstrated that some oils, especially refined oils with a high polyunsaturated fatty acids, they can actually degrade very easily because they have a little less smoke point to toxic components like free radicals, trans fats, and even malondialdehydes, etc., which are potentially atherogenic as well as mutagenic. That means they can cause cancer as well as heart attacks. Now, repeated frying of oils can further damage the oil and produce much more toxic components that are highly harmful. Indian studies have demonstrated that trans fatty acids contents of oil samples drawn from the halwais, those who actually use the same oils repeatedly for frying, have a very high trans fatty acid content. That means if halwai is using a oil again and again, it's bad, no matter what oil it is. But in that context, if we talk about that, a saturated fat, if used again and again, will be comparatively less harmful than unsaturated or refined oils. So that's why if a halwai is actually cooking in desi ghee, then that is actually better than other oils. But obviously in very limited amounts. That does not mean you can eat any amount of desi ghee kachoris and samosas. See, it is generally preferred to avoid refined oils. Not exactly refined, but heat extracted oils. Normally, cold pressed oils are the best, but they don't have much life. They go rancid very soon. We've already seen all these things. And heat generated oils, heat extracted oils, or solvent extracted oils can have side effects, can result in loss of antioxidants, and even produce trans fatty acids and free radicals. All of them are potentially dangerous, atherogenic, and mutagenic. But the same things can also happen with a crude oil while cooking. So, does that mean that we should stop cooking? No. So, it means that even though all these risks are there, the amount of oils used should be minimized. Any kind of oil. And even if you are using an oil to cook, The idea is to use those oils which have better omega 6 omega 3 ratio, less amount of saturated fats. Unfortunately, there is no regulation on how an oil should be extracted. So oils high in saturated fats like ghee or coconut oil are ideal for deep frying as they are more stable, but cannot be eaten in a high amount. Now there is another concept of blending of oils. Blending of oils combines the potency of two or more oils. It offers a balance of fatty acids and antioxidants, and this approach is used to enhance the oxidative and thermal stability of oils. Like, for example, if you blend rice bran oil with safflower oil, like a 30-70 ratio, and then there are much more added antioxidants and much more lipid lowering benefits and much more benefits for certain inflammatory markers, reducing your risk for cancers and heart diseases. Similarly, coconut oil can be mixed with sesame oil or canola oil can be mixed with flaxseed oils. So, this also appears to be a good option for an Indian perspective of cooking oils. So, to conclude, there are numerous research data which are now available to indicate that the sole use of or excess intake of any kind of these oils, may it be saturated, unsaturated, PUFAs, or vegetable oils or newer vegetable oils, are actually detrimental, are actually bad for health. And the best way is to switch to a combination of different types of fats, including traditional cooking fats like ghee, coconut oil, mustard oil, and switching your oils regularly. Changing your oils regularly, mixing and matching of these oils are advisable so that your antioxidant requirements, your omega 3 requirements are fulfilled, and there is a much more significant reduction in the health risk of dyslipidemias, of atherosclerotic heart diseases, and even diabetes, and all those Alzheimer's, obesity, cancers. So all these risks can be reduced if you actually eat combination of these oils or mix and match, change your oils for the preparations regularly, then that's the best approach. In either ways, the idea is not to eat more than 10 to 15% of your daily calorie intake from any kind of fats. That's what the home taking message is, that in general in India, a healthy adult eats 2500 of calories per day, out of which you can actually eat 400 to 700 calories from fat. That means if 1 gram of fat is giving 9 calories, that means you can eat 40 to 70 grams of fat per day. And in this 40 to 70, average we take 50 to 60, 55, 50. So around 50 grams of fats you can take safely as a target on a daily basis if you are a healthy adult. And out of this 50 grams, you have to mix and match and include all types of fatty acids, saturated, unsaturated, PUFAs, omega 3s, omega 6s, all these need to be included to have the best health effect. So it's not about what oil you need to use, it's about knowing about all these things, it's about knowledge. So you need to mix and match. You can use mustard oil, you can use coconut oil, ghee, you can even use canola oil, rice bran oil, but you need to know the contents and you need to know what oil you are mixing with which oil. So good luck with your oils, good luck with your cooking. I hope you gain some knowledge from these videos, and we will be addressing more videos on these topics. We'll be talking about specific oils in details in further topics. So don't forget to subscribe my channel as well as subscribe this playlist. This playlist is on fats, and if you haven't yet press the bell icon on my channel, then go into that first. Hope you share this video because there is a lot of ill-defined knowledge and misunderstandings on this topic on the internet. So go and do your own research. I'll advise you to go on researching studies. Look for the word partially hydrogenated whenever you buy any product which might be baked or cooked in fat. So I'm Dr. Paramjeet and you're watching Dr. Education. Thank you for watching.